If you are a GP and have thought about working in a prison or just curious about prison med, then this video is for you. Hello, I'm Dr. Imran Malik and I talk about all kinds of topics of interest to GPs as a whole and locums in particular. That's why today I want to take the lid off prison medicine and have a peek inside. Now, many of our presumptions might be based on films and TV shows like Orange is the New Black or Prison Break, Porridge and those sorts of things. Well, these have obviously all been sensationalized. However, one that is closest to reality, in my opinion, is the BBC's recent offering called Time, starring Sean Bean. Now, the prison environment is different to anything else. It has its own unique blend of noises and smells. There's radio chatter, the harsh clanging of metal gates, people laughing and shouting across the exercise yards, and the very particular scent of people living in confined spaces. However, once you are acclimatized, it all becomes remarkably familiar. I want to talk about prisons in general and then go through the various categories and then touch on the layout and mention some regulations and etiquettes when it comes to visiting a prison. I'll also talk about some of the demographics of the patients that you see and usual conditions that you may encounter in your consultations. Let's talk about prisons. There are 121 prisons in England and Wales, 12 of which are women's prisons, mostly in the public sector, run by His Majesty's Prison and Probation Service, whilst a few are run by private companies like Serco, Sodexo, G4S. The good news is that the clinical negligence scheme will indemnify GPs in all but 4 of these prisons in the same way as in the community general practice. Prisons are categorized from category A all the way to D. Now, category A is the highest category prison, meaning that they have the higher degree of security for the most serious crimes. Moving down to category D, which are open prisons for people just prior to release. Remand prisons have a much higher degree of churn. Remand prisoners are those awaiting trial or sentencing, and so remand prisons are a heck of a lot busier. The most common age bracket is between 30 and 39, which is obviously much younger compared to the people we encounter in the community. The prison population is unfortunately increasing year on year. There are 84,332 prisoners detained at this moment in time, which is up something like 3,000 on the year before, and the demand for prison medicine is going up as well. Similar to general practice, prisons come in different shapes and sizes. The old Victorian prisons such as HMP Dartmoor, based in Devon, which opened in 1809, as well as the newly built super prisons like Berwyn in Wales, which is, I think, UK's largest prison, just opened in 2017 with a capacity of 2,100. Now compare that to the size of East Sutton in Kent, which is a female prison with just 100 prisoners. So you're about to enter a prison. Here are 5 things that you need to know. Number 1, leave your mobile phone in the car. Now, most electronic devices like mobiles, laptops, Fitbits are considered contraband, and you can get into a whole world of trouble if you bring them into a prison. Even seemingly benign objects like chewing gum is considered contraband as well. It can be used to block up locks and that sort of thing. Now, there is a list of other items that you can't bring into a prison, usually laid out in the entrance. Point number 2, you have to go through the gatehouse. This is the entrance with which you have to pass through in order to get access to the prison. Now, Security A prisons are a bit like airport security with x-ray machines, metal detectors and occasional sniffer dogs, whereas Category D are usually much more relaxed and you may only have to sign into a visitor's book. Point number 3, you will be asked to show some photo identification, so something like your passport or driving license, and without that you will not be allowed to enter. Point 4, your visit must be expected and your name has to be on the gatehouse visitor log, which is organized by the Prison Medical Administration. Point 5, just be ready. You may be asked to give your fingerprint and have a photo taken of you before entering. Now, the governor or governess is in charge, and there will also be a team of managers and officers running the various departments. The officers will have access to the security information of the inmates, but not the health records. So you must always have patient confidentiality in mind when talking to operational staff. Now, operational staff are overall in charge And although they would be remiss to ignore your advice, they do trump you. Prisons have several different sections. There are industries, catering, gymnasium, chaplaincy, gardens, but most pertinent for us, they have a central healthcare department, which is modeled on a community clinic, complete with clinic rooms, a dental suite, and a pharmacy. You will be working with a team of nurses, and they will be visiting specialities like opticians, dentists, physiotherapists, psychiatrists, and podiatrists. Larger prisons will have a designated inpatient unit, usually housing people with extreme mental health problems or frailty, or indeed an acute medical condition. They may have certain facilities like the ability to stitch wounds and possibly give IV fluids and antibiotics, but most patients requiring intense intervention will be escorted to the local hospital by officers. GP clinics take place in the healthcare department or clinic rooms dotted around the prison on various wings. You will initially have to be escorted around the building by an officer or a healthcare assistant, as you will not have access with the keys. Moving from one part of a prison will often involve navigating multiple corridors, unlocking doors and gates as you go. Even visiting the loo will require someone unlocking the toilet door. Once you have a key talk, you will be able to draw your own set of keys, in which case you'll be given a chain and a pouch to securely fasten that to your belt. It's important to know some of the jargon and slang and acronyms that are used in the setting. Once you are arrested, someone is called a detained person in police custody suites. Once incarcerated, they are now prisoners. However, once crossing the healthcare threshold, we would call them patients. They usually reside on wings, billets, or houses. Prisoners will often refer to officers as screws, which harks back to the Victorian days where prisoners were made to turn a wooden contraption as a punitive punishment, and officers would tighten or loosen the screws in order to make the turning harder or easier. VPs are vulnerable prisoners due to the nature of their crimes. They are kept separate from other prisoners for their own safety. A freeze is sometimes referred to a temporary restriction of movement of prisoners within the prison due to some security measure or movement of other prisoners around. CSU is known as a care and separation unit, aka previously known as segregation. It's a unit where people are kept if they have contravened the prison rules and are in solitary confinement for a period of time. Now, GP rounds do take place on CSU 3 times a week, just to eyeball and make sure everyone is safe to be detained. Inpatient medication IP and not in possession medication NIP. Now, medication can be given to prisoners, or patients rather, to keep in their own possession, which is known as IP. On the other hand, not in possession medication is where the medication is given by the nurses at the medical hatch on the medication rounds at set times. This is typically decided in accordance with the risk assessment of the patient and to see if they are safe to handle their own medication. An ACT book, ACCT, is a log book that is opened when a patient may be at risk of suicide or self-harm, and ensures that they are checked several times an hour depending on their level of risk. A dirty protest. Well, these can be quite complicated topics, but briefly, prisoners can protest by either smearing or projecting their urine or feces. Capacity assessments are particularly important in these cases. Packing refers to the concealment of drugs or contraband rectally or vaginally. Diversion, palming, or cheeking refers to when a patient is given a pill to take at the medication round, but instead of swallowing it, they conceal it and take it back to the wing in order to trade or take later. This is of course against the rules. Reception or first night refers to the admitting section of the prison where new prisoners are inducted, assessed for medical needs, and then you have to prescribe their usual medication. Code blue, this is a code which is called when on the radio in a medical emergency, for example if somebody collapses, and a code red is more of a critical code, for example someone having a cardiac arrest or an arterial bleed, for example. Prisoners will often use slang words when referring to drugs. And whilst there are over 1,000 street names, here are some of the common ones that you should know. Now, gear refers to heroin, crack is cocaine, skunk or weed is cannabis, donkeys is quetiapine, acid is LSD, pregabs is pregabalin, sleepers are sleeping tablets, and there are many more that you might learn along the way. Now, before I go into the clinical practicalities and peculiarities, let me just take a moment to talk about having the correct mindset. You must always remember that you are an independent practitioner, regardless of how you are paid, whether it's directly from the prison or via an agency. Whilst working under the rubric of an operational system, our primary focus is always the health and well-being of the patient. There might be times when operational staff may struggle to get a patient to the hospital for an acute treatment because of staffing issues or security. However, in times like this, they may lean on you a little bit, but you must always politely and calmly but assertively explain your recommendation. And it can be difficult. I mean, you may encounter a case or, for example, somebody having non-specific chest pain, for example, where you think a patient is probably all right, but you don't want to take a chance. And you may well be instructing a team of officers to transport the patient to hospital in the back of an ambulance, only to return a few hours later with the diagnosis of musculoskeletal or something. It doesn't matter. You always have to err on the side of caution. Do not take a risk with the patient's safety or your GMC registration. You have to be able to sleep at night. Now, in the community, you can tell a patient, that if something happens, X, Y, or Z, call an ambulance or go to A&E. There is that safety netting in place, but in a prison, you are the safety net. Now, there are no specific qualifications for working in prisons. However, the substance misuse part 1 is recommended, and it simply consists of a one-day course. Now, if you plan to work regularly or long-term in prisons, then it is worth taking the RCGP part 2, which is much more involved and takes about 6 months to complete. It isn't mandatory, but certainly respected. I think it's important to have some accident and emergency experience, as you will see fractures, burns, and acute medicine. Prisons are not entirely the sterile environment you may imagine. Despite the various security measures, there are often many illicit drugs being bought and sold in the black market that thrives in the underbelly of the establishments, and the scale of this problem varies from prison to prison. Drugs including heroin, cocaine, cannabis, etc. are often smuggled or simply thrown over the wall, or if you can believe it, even dispatched by drones. And just a special mention of one drug which has become notorious in the last 10 years or so is called spice. Its use has caused real problems since it is a synthetic cannabis. It is often difficult to detect and can cause extreme aggression, hallucinations, and peri-arrest situations. Prescribing in prisons is a highly monitored and regulated activity, so it's worth reading the RCGP guidelines of prescribing in a secure environment. I will leave the link below. Every prison will have their own formularies, but there are a few medications that are of scrutiny across the board, such as opiates, gabapentinoids, Z-drugs, and benzodiazepines. Certain medication may seem harmless, but can be used in novel ways, such as buscopan, which is now banned on many estates, as it can be smoked in order to get high. Some inhalers can be refashioned as bongs. Ensure drinks can be used in homemade recipes to make hooch, which is an alcoholic beverage. And these are just to name a few. Most consultations will involve mental health issues. Now, there's lots of mental health problems in prisons. There's musculoskeletal problems, pain management, and the usual mix of GP problems that you can encounter. You can order lab tests, and some prisons have visiting on-site X-ray and ultrasound. Now, you will occasionally come across unusual pathology unseen elsewhere, as patients may be masking their problems with drug or alcohol and therefore present to you quite late. When seeing patients, please show kindness and empathy without being a walkover. If you show respect, then they will usually be polite and respectful back. Some prison GPs have a very combative approach, which just causes unnecessary aggro. Like in general practice, you will usually be running a clinic And once done, you will have the usual tasks to complete: rewriting medication, filing blood results and letters and that sort of thing. You will be using a system called System 1 for your clinical records. Now, some prisons will have 2 or more clinics running every day, whereas smaller prisons will have a doctor clinic on odd days of the week. Some sites increasingly using remote prescribers with secure laptops and mop up the daily tasks from home. You may be offered this sort of work once you become more regular and established. You may wish to work in the first night or reception, which will involve effectively clerking in your new residents, making sure they have a physical health check and that they have their usual medication prescribed. You can usually access their GP summary care records to confirm their medication. You must be vigilant to make sure that their essential medication particularly is given to the patients, such as those that are suffering with epilepsy, type 1 diabetes and asthmatics. You will need some experience in dealing with substance misuse and alcohol withdrawal too, if you're doing those sorts of evening clinics, as often patients may have been given diazepam or codeine in police custody suites as a holding measure, and now you will have to induct them into a detoxification or stabilization program involving drugs such as methadone, Librium and symptomatic relief like paracetamol, metoclopramide, mebeverine for stomach cramps. Prison medicine can be rewarding but also challenging. You will need to have thick skin. Verbal abuse and threats are not uncommon. Physical assaults are thankfully very rare, and your clinic room should be equipped with a panic button somewhere around. While we do want to advocate for patients and help them, we do not want to enable them in their counterproductive behavior or habits. They may exaggerate symptoms in order to get addictive medication, and we have to adhere to the various clinical guidelines on best practice and feel comfortable to say no in certain circumstances. If you work exclusively in prison medicine, it can become difficult to keep up to date, so you must actively make sure you are keeping up with the refresher programs and training. You will be working under the scrutiny of several external interested parties such as prison advocacy groups, lawyers, ombudsmen and coroners. Although you will come across some very difficult customers, there will be many times when you are able to have a positive impact. Some of the younger people you will encounter may have come from quite traumatic childhoods with very little pastoral care, and so may benefit greatly from good advice and therapy. The healthcare department should have all the key equipment that you need, which is always good, so you don't have to bring anything in, and you do not have to obviously perform home visits. There is not quite the same time pressure as there is in the community. It is extremely easy to find prison work. Larger settings are much more sociable as you are working in larger teams. You may be left in a room for extended periods of time on your own, sometimes just waiting about, so you need to be ready for that. It's a good idea to bring your own lunch, carry some tea, bags, coffee, water bottle, and have an enjoyable book to fill the gaps between clinic. The internet access and landlines may need a passcode. And as a quick mention, if you have any experience or questions about prison medicine, please leave a comment down below. You can get a salaried job or work as a locum. The locum rates are comparable to the community, and the mean is probably around about £100 an hour, with experienced GPs earning more, especially in busier settings. Some sites will pay you through lunchtime as they recognise that you aren't able to just simply pop out for lunch, but others will not, so it's worth negotiating this with your agency or HR department. Prison medicine is by no means a male-dominated affair. There are plenty of female GPs too. I'm always happy to guide people and point you in the right direction. I do have several shifts on my website if you are interested to take a look. My advice is always start with some shadow sessions, and you may need some separate training on how to use System 1, but that's easy to pick up. You can find other locum agencies that work in prisons. It is a specialist niche, and they will help you to get security norms clearance, which is more involved than the usual DBS check that we all have to undergo. My advice is just give it a go. It's worth a try. You may like it, and there's always a demand for this type of work. I hope you have found this video informative and have learned a thing or two. I would love to hear your feedback or experiences in the comments below, and I will see you out there on the circuit. Stay safe.